You're listening to the Quint's podcast.
Yoga guru Baba Ramdev seems to struck the wrong chord again with his comments on COVID. While previously he peddled Patanjali's herbal concoction Coronil to be a 100% cure without any scientific basis, now he seems to have offended allopathic doctors across India with unscientific claims, mockery, and insensitivity to downplay the severity of the pandemic. The controversy surrounding Baba Ramdev's statements started amid a breakdown of health infrastructure and oxygen shortages due to the virus that has claimed over 3 lakh lives now. A video of him surfaced online on 21st May where he's seen blaming COVID patients for not breathing properly. In the video, he can be heard saying, and I quote, "God has given us free oxygen. Why don't we breathe that? How can there be a shortage when God has filled the atmosphere with oxygen? Fools are looking for oxygen cylinders. Just breathe the free oxygen. Why are you complaining about shortage of oxygen in beds in crematoriums?" End quote. While families of patients and doctors condemned him for insensitivity, a couple of weeks later, another video emerged where he's seen blaming allopathic doctors for not being able to come up with a cure for COVID and blaming them for the deaths in the country. While he was forced to withdraw his comments as both the Indian Medical Association and the Health Ministry pulled him up on it, the damage has already been done. On 26 May, the Uttarakhand IMA sent a 1,000 crore defamation notice to him, stating that if he does not post a video countering the statements given by him and tender a written apology within the next 15 days, then a sum of rupees 1,000 crore will be demanded from him. For today's episode, we will analyze the claims that Baba Ramdev has made in the past and how the centre has been dealing with this serious problem of rumour mongering in this pandemic. You'll also hear from allopathic doctors about what they think about Ramdev's claims. For this episode, we spoke to Dr. Abhishek Tandon, a senior resident academic at AIIMS Jodhpur, Dr. Harjeet Singh Bhati, the former president for AIIMS Resident Doctors Association, Dr. Suvrankar Datta, a radiology resident at AIIMS Delhi, and Dr. Faiz Abbas Abidi, a junior doctor in Lucknow. You're tuned in to The Big Story, the podcast where we dissect the headline-making news for you, and I'm your host, Himmat. As we stated earlier, this is unfortunately and unsurprisingly not the first time that Ramdev has quoted controversy in this pandemic without facing any serious consequences for his words. Just a few days ago on 21st May, another video surfaced online where he's talking to people during one of his yoga sessions and can be seen mocking doctors and questioning the effectiveness of COVID vaccines. He said, and I quote, "1,000 doctors have died even after getting both doses of the vaccine. What kind of doctors are they if they could not save themselves?" End quote. And this was not the end of the unverified claims he has made. On 23rd May, another video surfaced where Ramdev can be seen claiming that allopathy is a stupid science and medicines such as remdesivir, Faviflu, and other drugs approved by the Drug Controller General of India have failed to treat COVID patients. In the video, Ramdev also claimed that lakhs of patients died because of allopathic medicines rather than a shortage of oxygen. In response to these statements, a furious Indian Medical Association urged the Union Health Ministry to prosecute Ramdev for misleading the public under the Epidemic Diseases Act. The IMA statement reads that Ramdev's statements are, quote-unquote, a threat to literate society of the country as well as the poor people falling prey to him. The Delhi Medical Association went a step ahead on 22nd May and registered a police complaint against Ramdev for describing modern medicine as stupid science. Their statement reads, and I quote, "Baba Ramdev has assaulted medical science and the medical profession apparently for personal gains." End quote. Doctors across India have voiced their anger at his statements. Dr. Abhishek from AIIMS Jodhpur said that doctors chose not to hide safely and conveniently behind a bubble like Ramdev has, and instead went to fight the pandemic every day.
In the past 1 year, I've lost a lot of colleagues, my seniors, my juniors. Some of them were married, some of them had newborn children, and they died serving the nation during the course of their duty. Not one day did they decide that they're not going to get up, go to that hospital, wear a PPE kit and serve the patients. They knew very well what they were getting into. They knew very well the risks involved. They could have had chosen to hide safely and conveniently behind a bubble like you did, but they did not. And I cannot tolerate a buffoon like you coming on national television and belittling their sacrifice. It's enough, Baba Ramdev, and it's time that you go out there and apologize.
Dr. Datta, a radiological resident at AIIMS Delhi, says that Baba Ramdev has created a mockery of the sacrifices that doctors are making every day since the onset of the pandemic.
See, Ramdev has traditionally enjoyed patronage of the politicians and the governments, irrespective of which wing, right wing, left wing, or the center. So, what I have seen is that usually the governments do not act against his accusations or his remarks because he has a huge following among the masses, and nobody wants to annoy these people who think Ramdev as maybe even in the rural areas, people think that Ramdev can cure any ailment and almost next to God. So that's a tricky situation. But what I feel is that the government should have taken a bold step, because right now what Ramdev is doing is solely for the popularizing and for the publicity of his enterprise Patanjali and his products.
Dr. Faiz Abbas Abidi, a junior doctor working in a COVID hospital in Lucknow, stated that Ramdev's statements are not only demoralizing but criminal in nature.
At a time when the country is facing serious medical emergency of COVID-19 pandemic and the entire workforce is involved in saving the lives of the countrymen, the remarks which were made by said yoga guru Mr. Ramdev, they are not only demoralizing but criminal in nature, as it has questioned the scientific integrity, the scientific wisdom of not only the modern medicine doctors who were busy treating the patients for last 1.5 years, but also his remarks, not only one remark, but his continuous remarks have questioned the integrity and scientific acumen of organizations such as ICMR, Drugs Controller General of India, AIIMS Delhi, and other eminent medical research organizations who are at forefront in framing the COVID-19 management guidelines. His statement that allopathy is a stupid science, I'm actually I don't know what to react on this, because this in itself is a laughable statement, and which any wise person would not have imagined from a person who enjoys a fan following of crores and crores of people.
But amid this wave of misinformation coming from an influential person like Ramdev and the kind of insensitivity towards allopathic doctors that he has displayed, while hospital staff have been dealing with overtime and shortage of medical supplies, the health ministry has only shown a muted response to the Baba. It was only after an appeal from the IMA that the Union Health Minister Dr. Harshvardhan took some action against the yoga guru in the form of a letter where he asked Ramdev to withdraw the quote-unquote extremely unfortunate statements. In the letter, he stated, and I quote, "Doctors and health workers are like gods for the people of the country, for whom they are fighting against the coronavirus, risking their lives. Your clarification yesterday is not enough to make up for it. I hope you will think hard on it and withdraw your statements completely." Facing flack from the government, Ramdev did finally withdraw his statements later, but without any consequences. In fact, just a few hours after his statement withdrawal, in a separate tweet on 24th May, he wrote an open letter to the IMA listing out 25 questions where he asked for cures for several diseases, including diabetes, hypertension, and blockages in the heart, along with cures for humanizing rude and violent people. In response to Ramdev's questions, Dr. Harjeet Singh Bhati, the former president for AIIMS Resident Doctors Association, stated that most of the questions are childish in nature.
उन 25 सवालों में से 20 सवाल तो सिर्फ यही हैं कि डायबिटीज का इलाज क्यों नहीं है, अस्थमा का इलाज क्यों नहीं है.
Out of the 25 questions Baba Ramdev asked, 20 of them are just questioning why there are no cures for diabetes, hypertension, asthma. And he has basically taken stock 20 diseases and asked them as separate questions. This could just have been clubbed under one question. The other five questions are even more childish, like why do allopathic doctors fall sick, how to cure rudeness in a person, how to cure old age. These questions are completely childish in nature and are just nonsense. In addition, diabetes and hypertension are not Ayurvedic terms, but in fact are allopathic terms. When it comes to diabetes, there is no procedure to check blood sugar or blood pressure levels of the patient. You require allopathic instruments to check the same. Patanjali, in spite of being an education institute, is asking such childish questions. In my view, the only reason they would do such a thing is to divert people's attention, the ground reality of COVID in hospitals, the shortage of oxygen, overburdened crematoriums, and the unpreparedness of the government to tackle the second wave.
एक एजुकेशनल इंस्टीट्यूट होने के बावजूद इस तरह से बचकाना सवाल पूछे, इसके पीछे एक ही कारण मुझे नज़र आता है, और वो एक कारण जो कि बहुत बड़ा कारण है वो ये है कि वो लोगों का ध्यान भटकाना चाहते हैं.
But the concern is the kind of wrong message that Ramdev's unfounded statements send to people in these critical times. From the very onset of the pandemic, he has made several unsubstantiated statements about possible cures, remedies for treating COVID in the past, and majority of these quote-unquote cures have been debunked. In the instance I mentioned earlier of his comments on oxygen shortages, he went on to say that he has increased oxygen levels in people from 70 to 80% to 98 to 100% through 1 hour of yoga. However, there is no evidence to back this claim. Apart from his tone-deaf statements on oxygen shortages and allopathic doctors, Ramdev's Patanjali product Coronil also made headlines last year, stating that it was a 100% cure for COVID that can treat the infection in 3 to 14 days. This statement was grossly misleading since both the Union Health Ministry and Ayush Ministry have noted that Coronil should be used only as a support for allopathic treatments for the virus. The Quint's fact-checking initiative WebCoof has also fact-checked the claim by Patanjali and found that there are several issues related to its basic study design and the sample size for the study. You can find a link to that fact-checking report in our show notes. Also, if you have any unverified information that you want to get fact-checked, you can send the details to the Quint's fact-checking initiative WebCoof on WhatsApp at 964-365-1818 or email it to us at webcoof@thequint.com. But going back to Patanjali's claims, the company also claimed, and I quote, Coronil has received certification from the Ayush section of the Central Drugs Standard Control Organization as per the World Health Organization certification scheme. This is yet again a misleading statement since the certificate which Patanjali refers to is merely a certificate issued in the format recommended by WHO to establish that the product and its makers are eligible for export to other countries. This does not mean that the tablets have been approved or recognized by the WHO as COVID treatment or a cure. The WHO, without naming Coronil, also clarified this in a tweet, stating that the WHO has not reviewed or certified the effectiveness of any traditional medicine for the treatment of COVID-19. Although later Patanjali did take a U-turn and issue a clarification that the certificate was in fact issued by the DCGI and not WHO. But despite all the unsubstantiated, unverified claims that Ramdev has made over the past year, the centre failed to take a stern action. While Ramdev's multiple insensitive remarks are going scot-free, the other side of the BJP-led centre's lack of action against people who've spread fear and disinformation is polarizing to say the least. Take this example for instance, where junior doctors on 23rd May at Jhansi's Maharani Lakshmibai Medical College were taken into custody by local police after they just tried to present a memorandum which listed demands and flaws of the college to UP CM Yogi Adityanath, who was visiting the college to take stock of the COVID facilities. In another instance, again in the BJP-led UP government, the National Security Act, a detention law, was invoked against a distressed man who posted an SOS call for oxygen as a last attempt to save his family member from succumbing to COVID-19. According to Dr. Datta, Ramdev's statements, given his massive following, are providing a sense of mistrust with the public, especially those suffering from COVID. He believes that the government should take a bold action towards Ramdev to prevent him from making any comments on modern medicine.
See, Ramdev has traditionally enjoyed patronage of the politicians and the governments, irrespective of which wing, right wing, left wing, or the center. So, what I have seen is that usually the governments do not act against his accusations or his remarks because he has a huge following among the masses, and nobody wants to annoy these people who think Ramdev as maybe even in the rural areas, people think that Ramdev can cure any ailment and almost next to God. So that's a tricky situation. But what I feel is that the government should have taken a bold step, because right now what Ramdev is doing is solely for the popularizing and for the publicity of his enterprise Patanjali and his products, which have no robust evidence of being able to produce any kind of medication which can treat leave aside corona, even most of the traditional diseases which is haunting our country right now. So what I'll like, we all read the letter which Dr. Harshvardhan has written. We appreciate that it took out time to write a letter, but I think that is not the final step which government ought to take. We should take bolder steps, and not only because it's detrimental for the healthcare system of the country to follow Ramdev's advice, because people who listen to him, there's a sense of mistrust being created by his words, and people will not come to the hospitals at the earlier stage. We'll be missing out on a lot of patients who come to the hospital at a later stage when they're very critical, and from which stage it's very difficult to revive those people. So it's very detrimental to the healthcare system of the country and the healthcare of the public in general. So at least to protect the people's interest, I think the government ought to take a very bold step, and which may require them to even detain him or even prevent him from any kind of comments about the modern medicine.
Despite the adverse impact on the morale and the efforts of COVID warriors and healthcare professionals over the past year, the Yoga Guru's wildly inaccurate claims like the one we listed are causing more harm than good for the millions who follow his word. India is still in a second wave of COVID, with over 2 lakh fresh cases and 4,157 deaths reported in the past 24 hours, according to the official health ministry figures. We must heed the warning of WHO Director General Tedros Ghebreyesus. We are not fighting a pandemic, we are fighting an infodemic. If you liked listening to this episode, please subscribe to The Big Story for episodic updates. We're available on Apple, Google Podcasts, Spotify, JioSaavn, and most of the other popular podcast streaming platforms. For other podcasts, please log on to the Quint website, and for any feedback, please shoot an email to podcast@thequint.com.
Thanks for listening. Log on to the Quint's website and check out our other podcasts.